مشفى مدينة أريحة خروج تام عن الخدمة.
Hospitals have been repeatedly bombed in what has been described as a systematic campaign to force the opposition to surrender. Hundreds of airstrikes by Syrian government and Russian warplanes have been documented throughout the years of conflict. Many advocacy groups, like Physicians for Human Rights, have tracked at least 595 air or artillery attacks on healthcare facilities in Syria since 2011. 2 years later, they were described as war crimes by UN investigators, who said the hospitals were being bombed to gain military advantage. But apart from condemnations, little else was done, and the rules of war continued to be ignored. The Russian and Syrian governments have denied targeting civilians or civilian buildings, despite evidence to the contrary, and international recognition of the widespread and sometimes deliberate nature of the attacks.
The health sector has been decimated. We know in northwest Syria, for example, the UN has said that 50% of health facilities are no longer functioning. We know that 70% of health workers have fled the country or been killed.
A survey by the International Rescue Committee showed the risks health workers and civilians faced in the past decade. 81% said they had a co-worker or patient injured or killed. 77% witnessed an average of 4 attacks on healthcare facilities. 68% were inside a health facility when it was attacked.
2 of the hospitals I was working in was hit. I survived, but the feeling is hard to describe. We all felt vulnerable. We all knew the risks of being in a hospital. It meant we could be killed.
A decade of attacks has also compromised the healthcare system and its ability to respond to the needs of millions of Syrians in opposition-controlled areas in the north. And the effects of the coronavirus pandemic are an added pressure on an already weak system where there is 1 doctor for every 10,000 civilians.
The situation is not good. There are millions of people in Idlib and the countryside of Aleppo. No matter how much aid we get, it's just not enough. We really suffer from a lack of medicines and medical equipment to treat chronic diseases.
A ceasefire appears to be largely holding, but it hasn't eased the humanitarian crisis. The violence has caused critical damage to Syria's health sector, affecting the ability of millions to receive proper health care. Zeina, Khodr, Al Jazeera, Beirut.